Okay, this video is why the high-fat phony diet is a slide into death. And by high-fat phony diet, I mean the vegan version of the Mediterranean diet. And what you'll see is the high-fat phonies even start backing off of 100% vegan. They start saying, well, a little fish is okay, a little poultry is okay, and it's not. And I'm just going to tell you, most patients don't do well. The cure rate for the common Western diseases in conventional medicine is 0%. They never get better. The cure rate for hypertension, 0%. Coronary artery disease, 0%. Type 2 diabetes, 0%. Okay? And so I'm saying, it's a wonderful thing. Like I had been heavily, into conventional medicine all my life until my 30s when I got fat. And then I couldn't lose the weight, and then I started to learn about the vegan diet and Dr. McDougall, and then later Kempner and Burkett and all this other stuff. And what I'm telling you is my attitude was, thank God there's something you can do. It's not inevitable. We're not all screwed. We don't all have to be fat, sick, and stupid, which is what the vast majority of patients are. We know what works. Kempner proved it in a rather extreme way. 3% of calories from fat, 4% from protein. I still eat about 4% of calories from fat, about 9% from protein. I find that works. I'm 63. I don't have any of the common Western diseases. I got old sports injuries, but none of the common Western diseases. McDougall was about 7% fat, in the ballpark of about 8% protein, and he had dramatic cures and health turnarounds for his patients with almost all the chronic Western diseases. Esselstyn's about less than 10% of calories from fat, in the ballpark of less than 10% from protein. He's not that specific about it. But what I'm saying is, we know that works. We know we can cure these diseases with that, okay? We can cure 100% of coronary artery disease, number one cause of death. We can cure 90% of hypertension. It's really a question of how soon you get to the patient before their arteries all calcified, and then it becomes irreversible. But we know it works, and it works really well, okay? So we've got a great treatment. Why would you want to mess with that unless you're doing careful research studies? And the one study with the optimized version of the Mediterranean diet, the so-called Lyon study, Esselstyn's diet was 32 times better than that, about 32 times better. Why would you even consider the piece of crap diet that's 32 times worse? Okay, and that's what all the high-fat phonies are promoting these days. It doesn't make sense. We know people who eat like this in the wild, close to the low-fat vegan Tarahumara, the Kenya, in 1929, Yanomami, Papua New Guinea, Okinawan, and many others. They don't get the chronic Western diseases, not at all. They don't have fat people. They don't have hypertension. They don't have diabetes. We know that fat's bad. There's tons of data on that. A couple of names that come to mind real fast: Ansel Keys, Roy Swank, Peter Quo studies. We know omega-6s are bad. Meyer Freeman, Ray Rosenman studies, the blood sludge studies, Tetsumori Yamashima, the Japanese guy who showed that omega-6 fats cause brain damage. He thinks it's the most common cause of dementia in Japan. They activate toxic aldehydes like hydroxynonenal, which destroys mitochondria, destroys brain cells, destroys pancreatic beta cells, so it increases the risk of diabetes, destroys the hypothalamic arcuate nucleus hunger center cells, so it leads to a more permanent type of obesity, more difficult to reverse. We know it has a strong tendency to undergo lipid peroxidation. The more double bonds, the worse that is. We know that Chris Knob, showed it's associated with all the common Western diseases. Omega-6 fats are bad. The high-fat phonies are now saying that omega-6 fats are not bad. That's a big misstatement. I think that's a big mistake, okay? We know omega-3s are totally overrated. They're often, contaminated, potentially with mercury. Lipid peroxide products, which are real toxic and lead to all those lipid peroxide chain reactions, free radical reactions, they're bad. That's why you put it in an opaque container and got to store it in the fridge. We know it's an immunosuppressant. All the animal studies increase metastatic cancer, increase prostate cancer in the human studies, increase atrial fibrillation, okay? It's possibly causing a problem switching out in your cardiolipin, intermitochondrial membrane phospholipids. Not much gets to the brain. Peskin says we're overdosing on this DHA and EPA stuff, and the body has nothing to convert it into. We know that MUFAs are totally overrated. There's no faucet on olive trees. They're obesogenic. They're about 14% sat fat, so you get all these sat fat problems. They have a large percentage of calories from omega-6 fats. You get the omega-6 problems. They're just liquid fat, so they're obesogenic. You're often not getting what you think you are. They're often contaminated, not the true versions, lipid peroxidized. intrinsically even the MUFA omega-9s are not good for blood flow. Why would you want to go down that path? It's a loser. Okay, the vast majority of patients, I said, in the Western world have very crappy outcomes. Conventional medicine is quite happy to announce it never cures these patients. 0 cure rate. Peripheral arterial disease, cerebrovascular atherosclerosis, cognitive decline due to cerebrovascular atherosclerosis and related problems like the Peter Rogers MD supply and demand theory, the abdominal pressure syndrome conditions, the leaky gut and the microclots from amyloid clotting like the Douglas Cal-atheresa praetoris work, the iron overload work. Okay, so the patients are all crashing and burning, and instead of giving them the one thing that works, you're going to throw them some good fats that are going to just be a continuation of what they're already doing and make them worse. Stupid. We know how to cure these diseases, almost always. Why wouldn't we do that? And the high-fat phony nonsense. You look at the high-fat phony diet. Okay, look at those recent videos. You know, at Viva and at other places. Okay, and those books from the high-fat phonies, they're in the ballpark of a 40% of calories from fat, or even more, 45%. You know, Willett's telling people he likes to eat nuts 3 times a day. Nuts are like 80, 85% fat, even 90%, some of them. He puts oils. The Willett Pyramid that Viva said is such a great paragon of research has oil at its foundation of what people should eat. That's insane. I'm not aware of anything to make me believe that. Nothing. Okay, in my opinion, this is ridiculous. This is why I jokingly call this jumping the shark. I think this is insanity. And why would anybody do it? Why would anybody do it? Why do people give amphetamines to children? Because it's profitable. And all the money comes from selling fat and protein. They allow avocados, 80% of calories of fat. Seeds, very fat, similar to nuts. Okay? They're also high in protein. The vegan Mediterranean diet allows food that's not organic. I think that's a mistake. In the past, organic wasn't as big of a deal. It's become more of a bigger deal because there's more toxic stuff in non-organic food nowadays, like atrazine and glyphosate. They promote routinely, the high-fat phonies will tell you coffee, tea, and caffeine are good for you. They're not. You know, it's like the equivalent of increasing your stress level. It makes you it increases your blood lipids, increases your blood glucose. It's diabesogenic, increases diabetes risk. Okay, increases dementia risk. Why would you want that? You pee out your magnesium. Okay, they're easy on the sodium. They allow sodium to be moderate levels. That's a mistake, unless you have a special rare condition. You know, they allow alcohol. They say MSG and MFG are okay. That's not true. Those are both brain toxins, excitotoxins. They don't make a fuss about filtered water. Filtered water is important, okay? They'll let you drink out of bottled water and microplastics. I think that's another big mistake. And then what I meant by the slippery slide into death, they keep on sliding back if you watch them. Watch these high-fat phonies. They're going to say, oh, chocolate's okay. Oh, a little bit of fish is okay. Oh, a little bit of poultry is okay. This is just going to kill tons of patients. Regular patients, they're not that solid in their thinking. You have to tell them, no oil, like Esselstyn says, not one drop. Then you've got a chance. You know, no animal food, like McDougall tells them. Then you've got a chance. But you start telling them a little fish, a little poultry is okay. You know, you can drink a little alcohol, have a little coffee. This is a disaster. You're just going to kill tons of patients, okay? And, you know, you feed the beast. You feed the conventional medical system. But, I mean, the reason I'm in this is try to help people. And people need solid rules like the 10 Commandments. Thou shalt not lie. Thou shalt not lie to these poor, helpless patients, okay? And, you know, it's been said before, like by McDougall, you don't tell an alcoholic they can drink on the weekends. You don't tell, you know, a cigarette smoker they can smoke on the weekends. You tell them, no more alcohol, never again. No more tobacco, never again. These are not 20 years old trying to maintain health. These are people, you know, 40 and up trying to turn their health around or save their health, okay? And you're just going to confuse them. And it reminds me of like Immanuel Kant. Nobody can know the truth. Nobody can know real meaning. Kind of the line of philosophic bullshit artists from Immanuel Kant to David Hume to Bertrand Russell, all these BS artists who act like you can never know anything, like Maya, you know, the concept of everything is unknowable. Bullshit. We know what works. We know exactly what to do. So why not do that? If we're going to study anything, study variations on this stuff, not this craziness about 40% fat. That is 10 times more fat than what Kempner was feeding. It's more than 10 times, all right? And as Pritikin said, the most important thing is to minimize fat. Fat is bad. McDougall, fat is the major toxin in the Western diet. So basically, we're ignoring all this stuff that it took so many years, these genius men, to figure out. And we know how to cure these patients. We know how to save them. But now we're going to turn our backs on them and lie to them and bullshit them so we can get a little bit more money from, these corporations. It's ridiculous. I think the whole thing's a joke. And that's why people say to me, well, why don't you address why oils seem to help this patient? No, it's all nonsense, okay? It's turtles all the way down. This is nonsense.